What is transference and countertransference in CBT? Imagine you're in a therapy session and suddenly feel a rush of anger or affection towards your therapist. Or maybe your therapist starts reacting in a way that feels personal. These are examples of transference and countertransference, two important concepts in cognitive behavioral therapy. They are about how feelings and reactions develop between clients and therapists, shaping the therapy process. Transference happens when a client unconsciously projects feelings from past relationships onto the therapist. For example, if someone had a strict parent, they might see the therapist as overly controlling, even if that's not the case. These reactions can be positive, like feeling admiration, or negative, like mistrust. Recognizing transference helps therapists understand how clients view themselves and others, revealing underlying beliefs and patterns. Countertransference is the flip side. It's when the therapist responds emotionally to the client, often based on their own personal history or unresolved issues. For instance, if a therapist feels overly protective or irritated, it might be because of their own past experiences. This reaction can influence how they interact with the client, sometimes unintentionally. In advanced cognitive behavioral therapy, therapists pay close attention to these dynamics. Unlike some approaches that see them as unconscious or problematic, CBT encourages awareness and management of these feelings. Therapists are trained to notice their own reactions and reflect on them, often through supervision or self-awareness exercises. This helps keep the focus on the client's goals and prevents personal feelings from clouding judgment. Using transference reactions, therapists can gain insight into a client's core beliefs. For example, if a client becomes angry when challenged, it might reflect feelings of rejection from past experiences. Addressing these reactions directly with questions or guided discovery can help clients see how their past influences their present relationships. Therapists also work to recognize countertransference so it doesn't interfere with treatment. If they notice feelings of frustration or overprotectiveness, they explore these emotions to stay objective. This self-awareness helps maintain a strong, professional relationship. Overall, both transference and countertransference are seen as opportunities in therapy. They can challenge the process or deepen understanding, but only if managed carefully. By staying aware of these dynamics, therapists can better support clients in changing unhelpful thoughts and behaviors rooted in their relational patterns.